Hi, everybody. I'm Amna Nawaz from the PBS NewsHour, and I am honored and excited to be here today to have this really important conversation with Dr. Laurie Zephyrin. This idea, this topic, I think a lot of people find it hard to kind of define for themselves what it means, what structural racism means. And we talk about it across a number of institutions, but specific to healthcare. When you think about structural racism in healthcare, what do you think about? What does it look like? How does it show up?
It shows up in many ways. I like to break it down in two ways. One, let's talk about the social factors that impact health, and then let's talk about how people experience health and health care within the healthcare system. And so, we all know that social factors have an outsized impact on health. And we know that, where people live and work and play and the effects of that. And so in terms of, where people live, Black and Hispanic people live in communities where they're exposed to higher pollution, have access to less adequate nutrition and housing and toxic environments that can cause like higher rates of asthma and cancer. And we see this manifesting today as we think about, the impacts, as we think about the COVID-19 crisis. There's also the stress of being in over-policed environments or living in communities with disproportionate amount of police surveillance. There's even new research coming out just showing the impact of health outcomes on that. There's, access to high-paying jobs that provide paid leave or provide enough wealth building opportunities, and also the ability to access healthcare, that coverage piece, right? If you don't have a high-paying job that provides health insurance, that also creates inequities as well. And then, as we think about care within the four walls of the healthcare system, we'd like to think that, our healthcare systems are immune to racism, but we have to understand that, the people within the health system and the healthcare system is part of our broader American society. And so we have to see how people are treated when they get care, right? And when we think of our healthcare system, which is steeped in our society, there are biases, for example, thoughts that Black women can tolerate more pain, data showing different quality of treatment being offered to Black people, studies detailing bias and discrimination. And how does this manifest when we think about maternal mortality rates? I think that's the tip of the iceberg, really, of a sign of a healthcare system that's failing people most vulnerable to these inequities.
Well, let's be specific about this because I'm not sure most people know about these maternal mortality rates, and it's something we should note. The Biden administration just recently highlighted, right? They called together a summit, said this is an absolute crisis in America. It needs to be addressed. The fact that it's getting presidential and White House level attention should tell people just how bad it is. People have babies all over the world, but here in America, the disparities are clear. Tell us a little bit more about how you've seen that structural racism show up when it comes to maternal mortality rates.
Absolutely. Well, just as you've highlighted, when we look at maternal mortality rates in this country, and we compare ourselves to other developed nations, we have the highest maternal mortality rates, and they're not going down. First, let's take the disparities. If you think of why this is happening, there's so many reasons, but here are the top four. For example, Black women don't get the care they need before, during, and after pregnancy, right? Whether it's a disproportionate number of Black people being uninsured or not having access to that care is really critical. Societal racism is literally killing Black women. Racism is baked into our American life, and our communities and hospitals are no exception. And so, our society has produced inequalities that leave Black mothers more vulnerable to poor health and poor health outcomes, having less access to primary health care, to healthy foods, reliable transportation, and safe neighborhoods and good schools and decent jobs. There's another fact, like if you're a Black woman in America, regardless of your education, you are 2 or 3 times more likely to die during childbirth than a white woman. And so, So when Black women seek care, for example, they're often not taken seriously, regardless of how educated they are. I mean, we've all heard the stories of Serena Williams and there are countless others. And so education is not a protector, and when you talk to Black moms, there's data showing that black moms don't get the same respect and attention when they show up at hospitals, or prenatal visits are often rushed, or doctors and nurses don't listen to them. So there's research that reflects these really disturbing patterns. And so as we think of this implicit and explicit bias in our healthcare system, it's really costing the health and lives of women of color. And I mentioned the fourth thing is, when we think about just the impact of racism and discrimination, that's very stressful. And that stress can manifest in also an impact on people's health, right? People refer to it as the weathering phenomenon, which is, the thought of like these indignities of day-to-day racism, or sort of bolstering oneself against racism can literally age Black women prematurely and chip away at their health.
I've also heard it referred to as toxic stress, right? A number of studies and long-term kind of looks at this, showing exactly how detrimental it can be specific to Black women in America. These stories you're sharing, we all know the experiences that women of color in particular have in our healthcare system. That leads to mistrust in that system in the first place, right? And when you look at the numbers of who's allowed to even kind of exist in those highest ranks, to make it to be a doctor in this system, women of color are sorely underrepresented. Talk to me a little bit about trust, about how to build that when people who are seeking care there and don't receive adequate care there aren't seeing themselves represented in those ranks.
Right. So building trust is I think central. And, as a physician, in my interaction with patients and people, I really believe it's my responsibility to build that trust. And I think that responsibility extends to health systems and government and leaders, because we see the many ways that mistrust can, manifest, from unequal treatment outcomes and experiences that I've mentioned before. So yes, I believe there is a way to build a health system that everyone can trust. And I think first we must fundamentally value people and individuals. We need to be able to build compassion and empathy to engender that trust. When I walk into a healthcare system, there's already a power dynamic. This isn't sort of Laurie doctor, it's just sort of Laurie. There's already this power dynamic and this sort of stress, because you're not going to the hospital for fun. You're going because you're seeking answer to questions. You're concerned about the health of yourself or your family member. So that in itself is a scary experience. And so when I'm walking in, someone that's at the door that says, "How are you today? How can I help you?" Right? I mean, that makes a big difference in building trust. And so that's what I mean when I say it's the responsibility of the entire healthcare system to build that trust.
What kind of changes could leaders out there be putting in place today that would help to lead to better healthcare outcomes tomorrow?
I approach it as thinking, top down and also bottom up. Top down in terms of what are the big P policies that need to be in place, and then bottom up, what are things that can happen at the community level, at the ground level that can be supported. From the top down, in terms of big P policy, we know that policies have deeply entrenched systemic racism, right? From policies affecting housing to access to jobs to access to education. There's a lot of information about that. Or if you think about policies like civil rights legislation, which helped essentially desegregate hospitals overnight because states could not get funding if they had segregated hospitals. And that immediately helped sort of create a significant decrease in Black infant mortality rates and maternal mortality rates. And so policies are powerful. And so how can, as we think about policies, and I think we're at an opportune policy moment, as we think about policies, just as we think of budget impact of policies, how can we think of equity impact of policies, right? Intentional equity impact of policies, or unintentional inequities that may result from policies. And so that's something that I'm thinking deeply about, and I think it's going to be really important to build that into our policy making process. And I think the bottom up piece, because policies take a long time to trickle down, how can we support people now through community-based interventions, supporting community organizations, diversifying the workforce? I think those are bottom-up approaches that we can start doing now to also address the inequities that we're seeing.
We know all that change is going to take strong leadership from folks like you. So Dr. Laurie Zephyrin, thank you so much.
Good to talk to you too. Thank you so much.